One other big question that I get is, what can I do at home, doc? What can I do to help this from coming back? Now, that's obviously why we go through that big history to decipher what is your day-to-day routine? What could be causing this? So one thing we tell patients is, if you're at a 10 out of 10 pain, it's not a time to rebuild and go exercise and go push yourself. Imagine if your house is on fire, do you want to start rebuilding it while there's still a fire? Of course not. You'd want to go and put that fire out first and then start to rebuild. Well, when our body is in crisis mode and we're really inflamed, maybe we're eating a lot of bad foods, we're really stressed at work, and we're doing a lot of things that maybe picking up kids and not getting good sleep, that's a fire right there. And if we can kind of help calm that down first, then our exercise programs, our rehab will be much more effective. So I usually tell patients, let's try and identify some of those areas that are really making this problem worse and fix those first before we give you a ton of exercises. I may send patients home with maybe a few stretches on the first visits, but we generally don't give a ton of exercises unless the person is fairly healthy and doesn't have a lot of issues going on. So the other idea of heat or ice, usually if the issue is a very acute injury, maybe we sprained an ankle, maybe we just pulled a back muscle, generally ice will reduce inflammation and make you feel a little numb in that area, which could give you some temporary relief, but putting heat on that afterwards in that first 0 to 72 hours would help get blood flow and healing back to that. Inflammation is really your body sending healing factors down there. So inflammation is good. We want that to happen, but not for long periods of time. So after the ice phase, we usually say, put some heat on it. That's generally, nice, warm, gets better blood flow to it, makes things feel looser.